and operational support to Liberia's public health delivery system. This 75th anniversary therefore gives us the opportunity to reflect on the major achievements in public health that have contributed to improve the quality of life of all Liberians. My government will remain committed to the advancement of quality public health care to all Liberians and will continue to maintain a strong partnership with the WHO in order to attain this goal. Distinguished ladies and gentlemen, happy 75th anniversary to the World Health Organization. I wish you all good health. I thank you for your attention.
As we are still grappling with the aftermath of a pandemic that took a large toll on our lives, our livelihoods and our economies, we have even more reasons to celebrate the World Health Organization's 75th anniversary. COVID-19 has indeed demonstrated that global challenges can only be tackled through global action. To address the major health crises of our times, including climate change and humanitarian disasters, we need a concerned multilateral approach and common efforts. I applaud WHO for its relentless commitment to health for all, regardless of where and how people live, and assure you that Luxembourg continues to be a reliable partner in this quest. I wish you a happy birthday and successful 76th World Health Assembly.
Delegates,
recording in progress.
We will now return to agenda item 14, public health. It would be appreciated if member states and delegates are seated. Delegates, we will now return to agenda item 14, public health emergencies, preparedness and response, and 15, review of and update on matters considered by the Executive Board under Pillar 2, 1 billion more people better protected from health emergencies, with the sub-items 14.1, 14.2, 15.1, 15.2, 15.3. I will not go back to the document. As we mentioned them in the morning, we are building on what we have been working on the day. So we are now beginning our debate with the countries, starting with Denmark, and will be followed by delegate from the Democratic Republic of Korea. Denmark, the floor is yours.
Thank you, Chair. Denmark aligns itself with the statement made of Sweden on behalf of the EU and its member states. I will now focus on item 14.2. Denmark appreciates the Director General's report on progress made in the implementation of the international health regulations. COVID-19 has taught us that no one is safe until everyone is safe. It is therefore imperative to ensure full implementation of the IHR in all special focus on developing core capacities to detect and manage public health emergencies in those countries that face the greatest risks and challenges. We believe that the regional offices play an important role in providing such technical support and capacity building. We are pleased to see that the report refers to the importance of communication, coordination and a One Health approach, both within and among state parties, as essential in ensuring successful implementation of the IHR. Denmark fully supports this sentiment. We also welcome the Secretariat's efforts in ensuring close interagency collaboration in the context of public health emergencies. We encourage the Secretariat to continue its systematic approach to multi-sectoral engagement, as well as monitoring related to the implementation of and compliance with the IHR. Denmark will continue to support and contribute to the revised State Party Self-Assessment Annual Reporting Tool. We believe that the assessment should be used actively by both state parties and the WHO to identify and address particular gaps and challenges in our health emergency preparedness and response capacities. We are therefore pleased to note the high response rate in 2021, and we hope to see this trend continue in the future. Finally, Denmark will continue to support the important process on strengthening the IHR through targeted amendments. In this context, we find it highly important to maintain the technical nature of the IHR and to ensure that the parallel process on a pandemic agreement does not result in redundant parallel provisions and structures. Also, the current negotiation processes should not halt the Secretariat's efforts in strengthening the collective implementation of the IHR. We urge the Secretariat to maintain its strong focus on building capacity for the full implementation of existing provisions in the IHR over the next 2 years. Thank you.
Thank you, Delegate of Denmark. Now the floor for Democratic Republic of Korea, followed by Delegate of Ethiopia.
Thank you, Madam Chair. The DPRK delegation would like to make some remarks under agenda item 14.2, 15.1 and 2. First of all, my delegation would like to express gratitude to WHO Secretariat for its active efforts to strengthen global architecture for health emergency preparedness, response and resilience, and especially for the coordination of global response to COVID-19. In this regard, we express our full support to the SARE regional statement delivered by the distinguished delegate of Bangladesh. In the past 3 years since COVID-19 public health emergency, more than 766 million infected cases and 6.9 million deaths have been recorded globally, and many people are still suffering from long COVID. This undeniable reality requires every member state to establish concrete preparedness strategy, not only for COVID-19, but also for future pandemics, while building up and strengthening core capacities of IHR. COVID-19 is a challenge, but not also an opportunity for WHO and all member states. As per the experiences and lessons learned from this pandemic, we recognize the necessity of amending IHR. IHR, while supporting the development of new pandemic treaty as well. In this regard, we assert to pay due attention to avoiding duplications between IHR and pandemic treaty, ensuring equity and respecting sovereignty of member states, and never allowing attempt to politicize the organization's activities. Besides, WHO, as an international organization dedicated to the global public health, should drive strengthening preparedness and response to public health emergencies in all countries and regions and across the world, thereby play the leading role in overcoming current and future health emergencies. Meanwhile, it is also important to establish a comprehensive and resilient public health and anti-epidemic system that is ready to respond to public health emergencies and disease outbreaks in member states. Madam Chair, preventive medicine is the basic principle of public health policy in DPRK. The public health law of our republic regulates that the government regards it as its important duty to take advanced measures to prevent people from diseases. In April last year, a national public health crisis emerged due to inflow of the stealth Omicron virus into the country. However, we have achieved a very great success in stabilizing and restoring the anti-epidemic situation over 100 days since COVID-19 intruded into the territory and 91 days since we switched the national prevention work to the maximum emergency epidemic prevention system. Thanks to the household doctor system, emergency medical system service, telemedicine system, and other people-oriented and advanced medical services, the identification of fever cases, screening and examination of the entire population were undertaken every day, and quarantine and treatment were conducted in an appropriate way. Pushing forward, building up the national crisis response capacity to reach the global standard is the firm will of the government of our republic. The DPRK will further strengthen national crisis response capacity to public health emergencies so as to defend the safety and security of the state and the people in close collaboration with WHO and other international organizations. In conclusion, the DPRK supports and sponsors the draft resolution proposed by the Russian Federation under agenda item 15.2, WHO's work in health emergencies regarding implementation of resolution WHA 75.11. Thank you.
Thank you. And now the floor for delegate of Ethiopia, followed by delegate of USA.
Thank you, Madam. Ethiopia aligns with the statement delivered by Tanzania on behalf of the 47-member state of African region on public health emergency and will address agenda item 15.2 in this statement. As reflected in the report, the African region and especially the Horn of Africa have been affected with additional burden on the regional economy, health system, and population health at large. Ethiopia being confronted with diverse health emergencies such as epidemics, drought, and floods in certain parts of the country. The government of Ethiopia, in collaboration with all stakeholders, is actively working to address these challenges. Currently, the country is providing cholera vaccination, conducting nationwide integrated supplementary immunization activities, and treating malnutrition and establishing national and subnational coordination mechanism integrating to public health care, primary health care. Furthermore, the government of Ethiopia is continually striving to ensure essential health service in all conflict-affected areas, including the northern part of Ethiopia, namely Afar, Amhara, and Tigray, as well as certain areas in the Oromia and Benishangul Gumuz regions. Chair, as you may be aware, the situation in the northern part of Ethiopia, including Tigray, has significantly improved since last year, November, Pretoria Peace Agreement, which was followed by the establishment of a regional interim government. The government of Ethiopia, in collaboration with the stakeholders, the international stakeholders, is making every effort to restore essential service, including health care, the community in Tigray. Presently, essential medicine have been restocked in regional warehouse and distributed to the health facilities, which helped the health facility in providing essential health care service to the community in need. However, considering the profound impact on the health system and the community, a strong and comprehensive response is required to rebuild the health system in a better way. The situation deems concerted effort, increasing coordination and restoration mobilization more than ever, and will call upon all stakeholders to collaborate with the government of Ethiopia for the continued response to health and humanitarian emergencies and for restoration and rehabilitation effort. Regarding the agenda item of 14.2 on the implementation of IHR, we wish to thank the Secretariat for the report and the Working Group IHR Bureau for the ongoing discussion regarding the amendment. Ethiopia has established a comprehensive public health management system at the national and subnational level to enhance preparedness and response, and stands at the health security index of 0.63 and the resilient index of 0.49. Based on SPAR 2020 self-assessment, the country average capacity is 74%. Despite our progress, we still face challenges in meeting the core capability, including the timely detection, surveillance, logistic, and point of entry capacities. We call up on all key actors, particularly the IHR Secretariat, to maintain and intensify their effort in implementation. We wish to see the operationalization of equity in the amendment of the IHR that includes support for implementation of core capability to better protect the world from public health threats collectively. I thank you.
Thank you, Delegate of Ethiopia. Now the floor to Delegate of USA, followed by Delegate of Oman.
Thank you, Chair. Russia's unprovoked war against Ukraine has created a humanitarian crisis in Ukraine with far-reaching health, social, economic, and other impacts in the region and globally. The brutal attacks by Russia's forces have displaced millions, destroyed critical health facilities, deprived millions of safe and reliable access to essential health services, and disrupted essential medical supply chains. The WHO last reported on May 4th, 2023, that Russia has attacked healthcare facilities 959 times and caused the death of 8,709 civilians. This is unacceptable and must stop. The displacement of millions of Ukrainians across international borders is also straining health systems in neighboring countries and across the region. The figures are staggering: over 8.2 million, with over 12.5 million return border crossings and more than 5.4 million people internally displaced. We thank WHO and the other UN humanitarian agencies and partners that are working tirelessly to provide millions of Ukrainians, including those forcibly displaced, with life-saving health services and related products, and we continue to encourage WHO's support of the health cluster to coordinate and prioritize humanitarian health action. As Russia's brutality continues, the impact on global health deserves the highest level of attention. We welcome and note WHO's updated report on the implementation of last year's resolution on the health emergency in Ukraine due to Russia's aggression. We express our support for the Ukraine decision associated with this report and urge WHO member states to keep the focus on the dire global impact of the health and humanitarian crisis in Ukraine by also expressing your support. We thank WHO and the other UN humanitarian agencies and partners. The United States also thanks the Director General for the report on WHO's response to health emergencies in 2022, and we welcome the update on the Universal Health and Preparedness Review pilots. The United States continues to be fully committed to the negotiation of a new pandemic accord and amendments to international health regulations to build our collective capacities to prevent and respond to future pandemics, and to do so in a way that expands equity for all. This year's sobering report of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program should serve as an urgent call to both the Secretariat and member states to renew our focus on the fundamentals of the WHE. We call on the Secretariat to take steps to implement the recommendations of the IOAC, in particular, to clarify roles and responsibilities across the three levels in line with WHO Decision 69-9, develop and resource a staffing strategy for the WHE workforce, ensure efforts to improve the resource base for WHO extend to WHE, and address organization-wide issues such as gender, sexual misconduct, and institutional culture that are particularly important to WHO's emergency work. The United States is committed to the IHR amendment process through the Working Group on Amendments to the IHR 2005, and will continue to work with member states to update the IHR to make it fit for purpose and able to address health emergencies at the earliest possible instance. Member states must continue to improve IHR implementation and compliance by implementing core capacities and striving to improve communications, connectivity, and transparency. The United States is committed to moving forward with a package of targeted amendments to the IHR at WHA 77 and ask that all member states dedicate time and effort to that important agreed outcome. Regarding the HEPR proposal, much has already been done to create and evaluate the current global health architecture, such as the International Health Regulations 2005 and its accompanying monitoring and evaluation framework that focuses on core capacities to prevent the spread of disease, and we must deconflict any potential issues that may interfere with current monitoring and evaluation. At the 153rd session of the Executive Board, the United States will propose that the EB task the Subcommittee on Health Emergency Prevention, Preparedness, and Response to carefully consider the HEPR proposals, report to the 154th Executive Board on any area of potential confusion or overlap, and provide a recommendation to the EB on how to address the identified challenges. On the clinical trials item, once the Secretariat releases the initial draft of the guidelines landscape of best practices for clinical trials, we request that an initial consultation be convened soon thereafter for member states to provide feedback before the guidance is finalized. For clinical research and outbreak response settings, we encourage the WHO to consult early and to coordinate with host countries, global experts, and vaccine and therapeutic developers and providers on the development and execution of well-designed clinical trials that respond to the needs of the country experiencing the outbreak. In closing, the United States wishes to extend our sincere gratitude for the work, and in particular to the staff of the WHO for their tireless dedication and service in responding to an ever-growing number of health emergencies. Thank you, Chair.
I thank the delegate of United States of America, and I now give the floor to delegate of Oman, to be followed by delegate of Vanuatu.
شكرا سيدة الرئيسة. عملت سلطنة عمان منذ دخول اللوائح الصحية الدولية 2005 حيز التنفيذ على بناء وتعزيز القدرات الوطنية الأساسية لمتطلبات اللوائح الصحية الدولية، وتطوير الإمكانيات والقدرات في نطاق الدخول والمساهمة مع الجهات المعنية في المطارات والموانئ في إعداد خطط الطوارئ للاستجابة للأحداث الصحية الطارئة في معابر الدخول. ويشارك فريق من المختصين في وزارة الصحة بسلطنة عمان في الاجتماعات المجدولة والموضوعة تحت مظلة منظمة الصحة العالمية لأغراض مراجعة ووضع التعديلات المقترحة على اللوائح الصحية الدولية، وتعزيز استعداد منظمة الصحة العالمية للطوارئ الصحية والاستجابة لها، وتعزيز الهيكل العالمي للتأهب والاستجابة للطوارئ الصحية والقدرة على الصمود أمامها، والتقييم العالمي للمخاطر من منظور الصحة الواحدة. داخليا اهتمت سلطنة عمان كباقي الدول بإدارة الأزمات والطوارئ، وذلك بالتخطيط الاستراتيجي لها وإعداد خطط للتعامل معها والاستجابة لآثارها، وإدامة التواصل والتنسيق مع الجهات المعنية، وضمان سير عمل جميع المنشآت الصحية بجميع محافظات سلطنة عمان من خلال مركز متخصص لإدارة الحالات الطارئة. عالميا شاركت وزارة الصحة في اجتماعات هيئة التفاوض الحكومية الدولية، وقد أرسلت المقترحات والتعديلات والإضافات المقترحة بالتشاور مع جميع القطاعات ذات العلاقة في سلطنة عمان على المسودة الصفرية إلى هيئة التفاوض الحكومية الدولية. وفي إطار التسريع بالعمل لتنفيذ نهج الصحة الواحدة، فقد استضافت سلطنة عمان في الفترة من 8 إلى 11 مايو 2023 اجتماعا إقليميا رباعي الأطراف لتسريع تنفيذ برنامج الصحة الواحدة في إقليم شرق المتوسط بحضور ممثلين عن القطاعات المختلفة من 22 دولة في الإقليم. السلطنة على توافق مع ما جاء في بيان إقليم منظمة الصحة العالمية لشرق المتوسط فيما يتعلق بالجاهزية والاستعداد للطوارئ الصحية، ومستمرة في دعم الجهود على المستوى المحلي والإقليمي والدولي لتعزيز منظومة التأهب والاستعداد للطوارئ الصحية والاستفادة من دروس الماضي والخبرات التراكمية والبحث والابتكار في بناء هيكل وقدرات تصمد أمام المتغيرات والتحديات المستقبلية. السيدة الرئيسة، الزملاء الأعزاء، على مدى السنوات القليلة الماضية شارك العديد منا في أكثر من مناسبة في المناقشات والمشاورات المكثفة التي كانت تجري حول المبادرة العالمية للصحة من أجل السلام. ويسعدنا في سلطنة عمان أن نرى أن قرار جمعية الصحة العالمية 24/75 قد تم تنفيذه، وأن خارطة الطريق التي نص عليها القرار قد أنجزت وهي معروضة في هذا الاجتماع. ويسعدنا أكثر ما شاهدناه خلال السنوات الخمس الماضية من جهد منظم وآلية عمل راقية عبر سلسلة متواصلة من المناقشات والمشاورات المكثفة والمداولات التي أدارتها أمانة المنظمة بمهنية عالية واقتدار، مكنتنا من الوصول إلى هذا المنتج الاستراتيجي الهام. ونثمن عاليا هذه العملية التي أسهمت في توسيع معارفنا ومداركنا للقيمة الكبيرة لمنظمة الصحة العالمية ومقدرتها على القيام بهذا الدور الذي حرصت فيه على إشراك الجميع في مختلف المراحل منذ ولادة فكرة المبادرة ونموها التدريجي وصياغتها وحتى ترجمتها إلى أفعال ملموسة. لقد أصبحت المبادرة العالمية للصحة من أجل السلام حقيقة واقعة اليوم، تبلورت ونضجت من خلال التشجيع والمشاركة والدعم الذي قدمته الدول الأعضاء والشركاء، وكان للجميع الفضل في دفعها من مرحلتها الجنينية إلى مرحلة النهج الاستراتيجي القابل للتنفيذ، أي خارطة الطريق التي نعتبرها استراتيجيتنا القادمة للمضي قدما لتنفيذ المبادرة. السيدة الرئيسة، الزملاء الأعزاء، نعتقد اليوم أن خارطة الطريق بأهدافها الاستراتيجية ونهجها ومبادئها ومسارات عملها واضحة بما فيه الكفاية، ونرى أنها في الظروف الحالية تفي بالغرض المطلوب، كما أن أولويات السياسات والاستراتيجيات التي حددتها أمانة منظمة الصحة العالمية لنفسها في إطار كل مسار عمل لل5 سنوات القادمة مناسبة أيضا. في بيان سلطنة عمان في المجلس التنفيذي الأخير أكدنا على الحرص على الوفاء بجوهر المبادرة والعمل على تحقيق مكاسب السلام الأساسية مثل المساواة والشمولية والمشاركة والملكية والقيادة المحلية ومراعاة خصوصية كل بلد في سياقها العام، لقناعتنا بأن ذلك سيسمح بتعزيز وتمكين المجتمعات الضعيفة محليا، وسيسهم بالتالي في تقوية التضامن الدولي والسلام والاستقرار والأمن. ختاما نود أن نشدد على أننا يجب ألا نفوت الفرصة المتاحة أمامنا، لأن تحقيق الصحة والسلام يحتاجان جهودا مكثفة ومتواصلة وهما مرتبطان، فدعونا نجعل الصحة أحد الجسور المؤدية إلى السلام. شكرا وتمنياتنا لهذا الاجتماع بالتوفيق.
I thank the delegate of Oman. Now the floor to delegate of Funuto and then followed by delegate of Bureau.
Thank you, Madam Chair. Greetings to all delegates participating in this important session. First and foremost, Vanuatu share the greatest gratitude to WHO Secretariat on the report of the Independence Overview and Advisory Committee for the WHO Health Emergencies Program. Madam Chair, the Republic of Vanuatu is a small island state in the Pacific that remains vulnerable to disease outbreaks, environmental and food-related emergencies, and the health consequences of disasters such as coastal erosion and intrusion, floods, landslides, droughts, volcanic ashfall, earthquakes, and tsunamis. In early March this year, 2023, Vanuatu again had 2 cyclones that made landfall within 3 days apart that led to the government declaring a 6-month state of emergency, which is current. More than 80% of the population has been affected and is slowly recovering from the impact of these cyclones. The COVID-19 pandemic has exposed the weaknesses of our health systems that has led to significant disruptions in the health services provided. Setbacks in our health gains and efforts to achieving our program targets. And the malaria increase last year in Vanuatu 2022 is a classic example that has pushed our efforts back to achieving malaria elimination to 2029. The challenges of COVID-19, severe tropical cyclones, and concurrent outbreaks has highlighted the critical importance of continuing emergency preparedness and essential health services through strengthening national capacity for coordination and response. Disruptions to travel, trade, and tourism brought to our shore by COVID-19 further emphasize the need for national resilience. Our population also faces an uncertain future due to climate change and the ever-present threat of natural disasters. There is ongoing need to strengthen and sustain national capacity in preparedness, prevention, response, and recovery using all-asset approach. A lot of effort has been put into strengthening our civilian system. In Vanuatu, where the human resource for health is particularly limited, it is often the same health staff managing public health emergencies and responding to the health consequences of disasters, thus leading to burnouts, mental health issues, and psychosocial support issues. In this context, we are examining how best to integrate and streamline efforts to ensure sustainability and resilience through the development of the National Action Plan for Health Security. Our 2022 self-assessing SPAR score for IHR core capacity stayed at 52%, which we think is well reflecting where we stand in terms of needs. Currently, the Ministry of Health is working hard towards establishing the One Health Committee, where all health All related line ministries will be part of the committee. WHO has been a key partner to the government of Vanuatu in planning, preparing, responding, resource mobilization and capacity building. We thank the WHO Secretariat and other development partners and supporting member states and continue to urge the support to protect the population of Vanuatu from the scourge of diseases such as COVID-19 and the natural disasters that are inevitable part of life in the Pacific region. Thank you, Madam Chair.
Thank you. Now, Delegate of Bureau, followed by Delegate of India.
Muchas gracias, señora Presidente. Mi delegación agradece a la Secretaría por la elaboración de los informes vinculados a los ítems 14.1, 14.2, 15.1, 15.2 y 15.3. Deseamos, en primer lugar, referirnos al informe sobre la aplicación del Reglamento Sanitario Internacional, o RSI. Con la experiencia de la pandemia de la COVID-19, sabemos que es importante fortalecer el RSI a través de enmiendas concretas, las cuales vienen siendo discutidas en el marco de un grupo de trabajo dedicado al tema. No obstante ello, el Perú cree necesario mejorar el cumplimiento por parte de los estados de las recomendaciones temporales del director general de la OMS, así como de los mandatos del RSI ya existentes. También creemos necesario optar por un sistema de alertas intermedias ante la sospecha de emergencias de salud pública. Podrá permitir tomar acciones oportunas para una preparación más temprana y una mejor asignación de recursos. Señora Presidente, en cuanto al informe titulado Fortalecimiento de la Arquitectura Mundial para la Preparación, Respuesta y Resiliencia frente a Emergencias Sanitarias, coincidimos que la crisis sanitaria de los últimos 3 años, que enlutó millones de hogares y trajo consigo graves consecuencias socioeconómicas, puso en evidencia que los desafíos mundiales tienen que ser enfrentados por la comunidad internacional de manera solidaria. No obstante ello, consideramos necesario traducir dicho principio en propuestas de medidas concretas. Por eso, el Perú viene promoviendo el principio de la equidad en el marco de las negociaciones del futuro instrumento internacional, para que permita garantizar el acceso universal a las contramedidas médicas, como las vacunas, sin discriminación ni privilegios, y que aborde cuestiones relacionadas como la investigación y el desarrollo, la transferencia de tecnología y la ampliación de la capacidad de fabricación local y regional de contramedidas médicas durante las emergencias. Señora Presidente, el Perú saluda el importante trabajo que viene realizando la OMS para responder a las diferentes emergencias sanitarias en el mundo y los logros alcanzados. Tomamos nota que tanto la COVID-19 como la viruela del mono han dejado de ser consideradas emergencias de salud pública de importancia internacional, al tiempo de recalcar que será importante seguir monitoreando cómo evolucionan dichas enfermedades a fin de estar preparados ante cualquier cambio sustantivo en el futuro. Vemos con preocupación que se mantienen diversas emergencias sanitarias prolongadas en diferentes partes del mundo, afectando a diversos sectores de las respectivas sociedades, en particular a los más vulnerables. Al respecto, saludamos los esfuerzos que ha venido desplegando la OMS a fin de responder de manera oportuna y óptima en las diferentes emergencias, como la de Ucrania. El Perú aprecia la crucial labor de la OMS para responder a la emergencia sanitaria y humanitaria en Ucrania, así como en los países que reciben y hospedan a sus refugiados. Teniendo en cuenta que la situación en Ucrania se encuentra en constante evolución, consideramos necesario que la OMS continúe informando sobre la labor que viene realizando, brindando una actualización antes de la próxima Asamblea Mundial de la Salud, por lo cual el Perú apoyará el proyecto de decisión presentada por Ucrania y un grupo de países sobre este tema. Finalmente, en cuanto a la Iniciativa Global para la Salud por la Paz, el Perú apoya plenamente esta importante iniciativa que busca materializar el vínculo entre la salud, la cohesión social y la paz, centrándose en el papel único que los programas de salud pública pueden desempeñar para convocar a diferentes grupos y fomentar la confianza. Por ello, apoyaremos su adopción. Muchas gracias.
Thank you, Delegate of Bureau. Now, Delegate of India, followed by Delegate of UK.
Thank you, Chair. The reports by the Independent Expert Oversight Advisory Committee have pointed out the chronic financial and staffing limitations faced by the WHE program. The COVID-19 pandemic further highlighted the inadequacy of the WHE program in handling a global pandemic while also responding to other emergencies. We reiterate that WHO, as the global leader, needs to garner all its expertise to make sure that the World Health Emergency Preparedness response runs at the best of its ability and should be adequately funded. Chair, India takes note of the Director General's report on strengthening WHO preparedness for and response to health emergencies, wherein, very rightfully so, the need for strengthening the global architecture for health emergency preparedness, response and resilience has been highlighted. India also takes note of 10 proposals under 3 crucial pillars of governance, systems and financing that have been brought out in this report. In consonance with the principles and proposals brought out in the Director General's report, India, under its G20 presidency, has prioritized health emergency agenda with an aim to converge the efforts going on globally to ensure optimal usage of resources. India has also prioritized medical countermeasure platforms and digital health to ensure availability of these tools to every country, especially LMICs and LICs, so that every country can address its health challenges in crisis time and also ensure better health service delivery to its citizens in normal time. Chair, in reference to the issues highlighted in Director General's report, we would like to highlight that there is a need for the convergence in various efforts directed towards health emergencies, prevention, preparedness and response, as well as deliberations being held for amendment to international health regulations, as well as development of the new pandemic accord. This would enable countries to prevent, remain prepared for and develop resilience to future global public health threats. Chair, we have learned many lessons during the last pandemic, and the world has suffered socially, economically, and many other aspects. As this health emergency is over now, we should not lose our focus on action and move ahead from principles and take tangible actions so we can prepare the world for the next health emergency. Thank you.
Thank you, Delegate of India. Now, Delegate of United Kingdom, followed by Delegate of Jamaica.
Chair, let me start by echoing statements made by others on the unsatisfactory nature of the grouping of these agenda items. We are grateful for the work of the IOAC under the leadership of Vladimir and the committee's detailed report. The need for WHE is indisputable. We endorse the IOAC's view that WHE should be strengthened with a focus on areas including alignment between the organisation's 3 levels, risk oversight and country-level staffing. We also support the important IOAC recommendations on PSEH. Great strides have been made to address weaknesses in this area, but we have to maintain the momentum. The risks of misconduct in crisis contexts are heightened. So we look forward to the updated emergency response framework publication, and we reiterate the need to improve the organisational culture in this area. On the international health regulations, Madam Chair, we strongly support the IHR as an important public health framework for countries to use, to plan and to prioritise investments. We applaud the ongoing support provided by the WHO, in particular the training and the experience exchanges among national focal points. We also acknowledge WHO and Member States' efforts to develop and to roll out version 3 of the joint external evaluation and the review of other tools in the IHR monitoring and evaluation framework. We welcome the fact that support for IHR implementation and capacity building continues in parallel with the work to strengthen the IHR themselves through targeted amendments. Once there is agreement on a strengthened IHR, we'll work with partner countries to flex support to meet new requirements and to continue to work with others to build both capacity and capability. Madam Chair, as the health emergency preparedness and response work continues, the UK supports the recommendations of the IOAC that the Standing Committee on Health Emergencies Prevention, Preparedness and Response should play a role in analysing and evaluating broader global health emergency reforms. And we think this role can be successfully fulfilled alongside its more operational portfolio. On clinical trials, Madam Chair, the UK welcomes the continued work of the Secretariat to deliver the activities at WHA 75, and we look forward to consultations later this year. The Executive Board held rich discussions on the resolution, including on the Secretariat's proposal for developing a self-assessment tool for clinical trial ecosystem development. In our view, whilst the Executive Board broadly supported the work of the Secretariat, it also asked for further work on the new self-assessment tool. The joint statement that we delivered at the Executive Board recommended that the Secretariat bring this proposal for consideration by a future session of the WHO governing bodies once progress had been made. We believe that WHA 77 is the appropriate time for the Secretariat to bring forward such a revised proposal. On the Global Health for Peace initiative, we appreciate ongoing efforts and we are happy to continue discussing the roadmap. This is an important initiative that we need to get right. We also note the continued breadth and complexity of emergencies that the WHO is supporting in countries to prevent, prepare for, and respond to. We would welcome more information on lessons learned from responses so as to inform response effectiveness and efficiency. Finally, Madam Chair, the UK reiterates our condemnation in the strongest possible terms of President Putin's brutal invasion of Ukraine, which continues to cripple health systems and cause grave health impacts, not just in Ukraine, but far beyond. And we note the Director General's report on the implementation of WHA 7511 and the harrowing reports contained within, including the over 21,000 civilian casualties, the over 900 attacks on health services, and the over 12 million refugees or internally displaced persons provoked by Russian aggression. The long-lasting impact is greater even than these shocking figures present. So we thank the WHO for its ongoing support to Ukraine, and we thank those countries hosting Ukrainian refugees in the face of that Russian aggression. We are aware, Madam Chair, that like last year, Russia has passed around pamphlets to our fellow delegates which allege that Ukraine has been attacking its own health system. Madam Chair, this is the theatre of the absurd. This is nothing more, nothing less than another example of gratuitous disinformation promulgated by the Russian state in an attempt to distract and confuse the World Health Assembly. We are confident that the vast majority of our fellow delegates here today won't be fooled by such disinformation or the cynical resolution which Russia has proposed, and will instead support Ukraine's draft decision and remain committed to the crucial work of ensuring that WHO can and will continue to support the health response in Ukraine and beyond. Thank you very much.
Thank you. Now the floor to Delegate of Jamaica, followed by International Council of Nurses.
Thank you, Chair. The experience with the COVID-19 pandemic provides a unique opportunity to develop national action plans for health security that takes into consideration a COVID-19 interaction review. Jamaica conducted a comprehensive interaction review in 2022, and we commend the support of the WHO that allowed for the conduct of this review, and especially thank PAHO for the tremendous support received. Many of the findings can be incorporated into a national plan as projected by the WHO Strategy 2022-2026 for the National Action Plan for Health Security. Jamaica will use the findings to plan for addressing priority areas identified for action within an all-hazards emergency response framework. The preliminary assessment indicates that some of the actions to implement the recommendations need external support. Some are already aligned to PAHO's Health Emergency Strategic Plan lines of action, including emergency workforce, laboratory strengthening, surge capacity development, and enhancement of emergency medical care. Chair, the impact of the COVID-19 pandemic was lessened by the capacities that were achieved on the work done from the implementation of the preceding PAHO 2016-2021 Plan of Action for Disaster Risk Reduction. It is important that we not lose momentum, but continue to strengthen preparedness and response, bearing in mind the strategic lines of action under the DRR 2016-2021. For Jamaica, 3 of the 4 areas of action attained significant improvement. These are strengthened coordination capacity through Health Emergency Operations Center and improvement in the governance system. Progress in safe and smart program for health facilities with support of PAHO for the smart healthcare facilities in the Caribbean project, and enhanced health sector capacity for health emergencies and disaster response through various workforce strengthening activities. We believe that consideration must be given to furthering this plan or in incorporating the strategic actions in the new plan to achieve some of the targets not yet realized. We commend the work of the quadripartite organizations in producing the One Health Joint Plan of Action 2022-2026 and look forward to its implementation. We commit to participate in regional discussions to guide its application for Jamaica and await guidance from PAHO WHO with respect to this plan. In the interim, however, we want to highlight that Jamaica is submitting a proposal to the Pandemic Fund that includes activities to enhance One Health capacities, to strengthen health systems and address antimicrobial resistance, and strongly urge the WHO to favorably consider and support small island developing states toward achieving this resilience. Chair, Jamaica is committed to strengthening core capacities under the international health regulations. Monitoring and compliance with the IHR is important to Jamaica, and achievements under the IHR contributed significantly to a strong COVID-19 response. We are also committed to work with the working groups on the amendments to the IHR and the negotiations of a new pandemic treaty. We ask, however, that the DG intervenes on behalf of small island developing states to ensure that there is adequate time to make contributions, bearing in mind our limited resources. We want to emphasize that we believe that the rush to complete the process puts us at a disadvantage and prevents our full participation in and contribution to the outcome. I thank you.
Thank you. Now, the International Council of Nurses, followed by delegation of Turkey.
This is a constituency statement on agenda item 15.1. The co-signatories, the NSAs co-signing this statement are FDI World Dental Federation, FIP International Pharmaceutical Federation, ICN International Council of Nurses, WMA World Medical Association, World Physiotherapy, Women in Global Health, International Association for Hospice and Palliative Care, International Society of Pediatric Oncology, and the International Federation of Gynecology and Obstetrics. I'm speaking on behalf of the International Council of Nurses, which is part of the WHPA, the World Health Professions Alliance. WHPA's recent report highlights the evidence and knowledge gathered by its 5 organizations on the impact of the pandemic on health professionals worldwide. The report provides profound evidence of alarming occupational risks and pervasive workload challenges faced by the health workforce, particularly women, who make up 70% of the health workforce and 90% of frontline health workers. And it highlights the severe consequences they faced during the pandemic. Another report, also endorsed by WHPA, detailed the life-altering implications of workforce disruptions on pediatric oncology and proposed targeted recommendations. We emphasize the urgent need to protect and safeguard health professionals and thus to improve the resilience of health systems in health emergency planning and response. The health workforce is the fundamental resource that bridges health systems from response to recovery to delivery of essential health services and public health functions in the pursuit of UHC, global health security, and WHO cancer initiatives. We call on member states to strengthen mental health and psychosocial support for health professionals, both during and after pandemics and emergency situations. Properly responding to this need means providing timely access to care for individuals in need, but also organizational interventions that reduce risk factors, such as improving working conditions, ensuring appropriate training in anticipation of future health emergencies, including palliative care and nursing, and respecting health professionals' rights. Safe and supportive working environments also ensure the retention of qualified health workers to maximize the investments made in health education and training. Lastly, we urge member states to curate and invest in systemic strategies to concretely address chronic violence in healthcare settings, particularly that faced by women health workers, and to ensure health professionals' participation in national planning and policy and finance decision-making, again with a focus on women who are historically excluded from decision-making. This can ensure that on-the-ground expertise informs decisions and ultimately benefits both patients and health systems. Thank you very much.
Thank you. Now, Delegate of Turkey, followed by Delegate of Brunei Dar es Salaam.
Thank you, Chair. We also thank the IOAC, the DG, and the Secretariat for the comprehensive reports. Turkey has always been a supporter of a more stronger and operational WHO on the field to meet the critical needs of the member states, especially in times of health emergencies. In line with this, we are hosting a GDO for humanitarian and health emergencies in Istanbul. As can be clearly seen in the DG's report, we are witnessing a WHO which is becoming more operational by supporting the countries through emergency response coordination as well as through technical and logistical support day by day. Though it is not recorded in the DG's report due to time concentrate on the activity period which the report covers, Turkey has experienced extremely destructive consecutive earthquakes on the 6th of this February. We would like to take this opportunity once again to express our deepest gratitude to all emergency medical teams who have been with us under the coordination of the WHO on the field. This earthquake has been an important experience in terms of how important the emergency coordination during massive health emergencies is and to see the strengths and gaps in the mechanisms at hand. With these in mind, Turkey would like to express its support and stress the need to keep up the momentum in the negotiation processes for the relevant member state-led initiatives to strengthen the WHO's central technical leading and coordinating role in health emergency prevention, preparedness, response, and resilience in legal as well as operational terms. Having experienced well during the earthquake response in our country, we also urge the Secretariat to take into consideration the recommendations in the IOAC report and enhance the WHO emergency management accordingly. Thank you for your attention.
Thank you, Delegate of Turkey. Now, Delegate of Brunei, followed by Delegate of Iran.
Thank you, Chair. Chair, Excellencies, ladies and gentlemen, the COVID-19 pandemic has highlighted the gaps and challenges that countries face in implementing IHR effectively. Robust review processes must be in place ensuring that technical assistance and resources are provided to countries with challenges. We congratulate the Working Group on amendments to the International Health Regulations 2005 on the significant progress made in work towards improving its implementation and compliance mechanisms. We believe these amendments are vital to ensure that this tool remains relevant, adaptable, and capable of effectively responding to evolving and complex public health threats. We will continue to work closely with the Working Group and other member states in this process. Since the IHR's entry into force, most of the focus of IHR capacities has been made at the national level. In particular, IHR core capacity requirements apply solely to member states. Moreover, currently, metrics for compliance are largely based on demonstrating national capacities. In order to ensure the continued relevance of IHR, Brunei Darussalam would encourage increased recognition of the importance of supranational or regional perspectives, particularly in terms of enhancing cross-border collaboration and identifying locally and regionally appropriate implementation strategies. Concurrent to the proposed amendments to the IHR is the ongoing negotiations of a new pandemic instrument that will ultimately redefine the global health security architecture. We believe this is timely and work on this should continue to be prioritized. However, in assessing compliance both to the IHR and the new pandemic instrument, Brunei Darussalam would urge the relevant bodies, states to carefully consider and balance the capacities and limited resources of small countries with competing priorities and avoid unduly burdening state parties with excessive reporting and evaluation. In assessing compliance, it is also important to distinguish non-compliance due to genuine inability to comply versus unwillingness or intentional non-compliance. Ladies and gentlemen, referring to the IOAC report, Brunei expresses concern that a key finding from this report is that despite the best efforts of the program and the executive director, the WHE program is overstretched, struggles to respond to the frequency of new emergencies, and would be significantly challenged in the event of a new pandemic like COVID-19. We urgently ask Secretariat if they agree with this finding and what their plans are to rectify this. In addition, we seek clarification from the Secretariat on a number of key points identified in this report. First, on the creation of the WHE Intelligence and Surveillance Systems Division and the WHO Hub for Pandemic and Epidemic Intelligence in Berlin. Can the Secretariat update the committee on their respective roles, the progress in operationalizing these new mechanisms, how they are linked, and plans to collaborate with member states' own epidemic intelligence and response systems? Second, on the discussions on the pandemic accord and amendments to the IHR, does the program have any recommendations for member states on specific items they wish to see included in this proposed text that could make their work easier and deliver better outcomes? Additionally, if the proposed changes do take significantly longer than expected and there is no agreement on these by the next World Health Assembly, does the program have a contingency plan that still manages to deliver on some of the issues identified by these processes nonetheless? Third, on the pandemic fund and WHE's work in supporting countries who are applying for PPR investment, does the program have a plan for supporting countries who may not be eligible for the pandemic fund in securing resources for PPR capability building via other means? Turning to the DG's report on strengthening the global architecture for health emergency preparedness, response, and resilience, we welcome the strategic shift towards an ecosystem approach to health emergency and the elucidation of the 5 Cs as core health emergency components. On this, we wish to comment on the components related to community protection, safe and scalable care, and access to countermeasures. On community protection, we encourage the Secretariat to make explicit reference to the need for more and higher quality studies on the effectiveness of non-pharmaceutical interventions, particularly in responding to emerging infectious diseases. These studies should apply robust methodologies and allow policymakers to understand both the likely benefits and trade-offs associated with implementation of public health and social measures. On safe and scalable care, we would have liked to see an explicit reference to the need for investments in critical care capacity and how we can flexibly adapt healthcare systems so that critical care can be scaled up during a crisis. This issue is one which, even among the high-income countries, was a key limitation observed during the COVID-19 pandemic. On access to countermeasures, Brunei reiterates our commitment to equitable access to countermeasures, and we support WHO's work to establish interim coordination platform for countermeasures. We urge that countries with limited manufacturing capacities are not forgotten in the push for strengthening local manufacturing of health-related products, and we believe it is essential that a permanent multilateral mechanism be established to support global supply chains for health emergency-related products and technologies. In conclusion, Brunei Darussalam stands firmly with the health community in strengthening our global health security architecture. The ongoing work to strengthen implementation of the IHR and the Health Emergencies Program play an integral role in ensuring equity, transparency, building trust, and promoting solidarity among countries. We reiterate WHO is fundamental to strengthening prevention, preparedness, response, and recovery of health systems. In addition to its normative standard-setting function, we believe that in health emergencies in particular, there should be a strong operational function to WHO's work. We will play our part in accelerating the changes needed to make our world safer, and will support all multilateral efforts to that effect. Thank you, Madam Chair.
Thank you, Delegate Pranay. Now the Delegate of Iran, followed by Delegate of Australia.
We appreciate the Secretariat for organizing the document A7608 and A7609, revision point 1, with regard to agenda item 14.2, preventing, preparing for, and responding to public health risks and emergencies, requires us to strengthen the core capacities for our health system at the national level. In most cases, the delay in events notification and risk assessment lies in the inadequacy of biosurveillance and technical capacities at the national level. To develop certain minimum core public health capacities, countries are encouraged to collaborate with each other in providing the required assistance through bilateral, regional, and multilateral channel in the spirit of Article 44 of the International Health Regulation. To effectively respond to future health challenges and emergencies and to strengthen the implementation of the International Health Regulation, we have to prioritize equity, multilateralism, international solidarity, and cooperation in our joint agenda. Guided by these principles and with due to respect to the sovereignty of member states, we can create an enabling environment for building health capacities and removing obstacles that generate global health challenges and inequalities. In the ongoing amendment process aimed at the strengthening of the International Health Regulation 2005, we actively continue our engagement in the process with the understanding that this process should not lead to reopening the entire instrument for renegotiation. The Islamic Republic of Iran will not support any measure that in any way undermines the sovereignty, security, and leadership of member states in health matters. The amendment process is an opportunity to member states to help operationalize the notion of equity and international cooperation with a view to promoting the universal application for the protection of all people of the world from the international spirit of disease and equitable manner. We continue our engagement in the IHR amendment process with this understanding that nothing will be agreed until everything will be agreed. With a view to enhancing sub-regional capacity to implement IHR, the Islamic Republic of Iran initiated G5 as a sub-regional health-oriented initiative to help improve the resilience of the health system at the sub-regional level with participation of Afghanistan, Pakistan, Iraq, and the World Health Organization and Tajikistan as an observer. During the COVID-19 pandemic, Iran did not close its border even to seriously affected countries at the beginning of the outbreak, despite externally imposed restriction as a result of unilateral coercive measures. Due to Iran's robust PHC structure, the country managed to rapidly foster its national vaccination development plan capacity for COVID-19 through establishment of around 1,200 mass vaccination centers and rival the developed countries' coverage in 6 months after the beginning of campaign. With regard to agenda item 14.1, as rightly mentioned in the document A7608, during a health emergency, especially a pandemic, the economic and political dimension are beyond the WHO capacities alone, and cooperation with partners is imperative, and committees concerned regarding when the world would be better prepared for a new pandemic on the scale of COVID-19 in the future is sound and logical. Strengthening the capacity of member states, especially developing countries, long-term efforts, and until then, upon request of the involved member states, they rely on the support of the WHO. With regard to agenda item 15.1 and document A7610, WHO support in the following areas of importance to support countries to build a better architecture for HEPR. 1. Developing preparedness and response plan with all-hazard approach. 2. Compilation of international and integrate standard tools in risk assessment and risk management. Developing the advanced technology of early warning system, hazard mapping, damage and injury estimation, simulation exercise, and telemedicine, developing programs and tools for evaluating and improving health system resilience, supporting applied research related to risk reduction management. In A76.7 Revision 1, we agreed that greater international collaboration and coordination are needed for efficient funding of agreed priorities and for multinational and multi-regional trials. However, some countries are facing challenges due to unilateral coercive measure of one developed countries with over-compliance of other developed ones, which make it difficult to improve new technology or receive grants from other countries to design high-quality clinical trials. Therefore, we highly recommend that a practical solution, or at least at a WHO resolution, to be adopted to address these challenges. Also, we acknowledge the need for greater capacity for clinical trials in lower-income countries with a focus on country leadership and equitable partnership for research in such country. Accordingly, we suggest WHO design a training program for low-income countries with the curriculum prepared by volunteer countries. Thank you, Madam.
Thank you, Delegate of Iran. Now, Delegate of Australia, then Delegate of Belize.
Thank you, Chair. I want to begin by echoing others' concerns on the late change in modalities compressing so many important agenda items into a single discussion. It is difficult for the Assembly to give real guidance on these critical issues working in this way. In the time available, we will make 7 points for the 5 sub-items. First, Australia recognises and reaffirms the central leadership of WHO in coordinating and responding to numerous large-scale emergencies, while also building capabilities for prevention and preparedness. We acknowledge that health emergencies are increasing in regularity and intensity, and we remain deeply concerned that this important work has been constantly hampered by funding gaps and lack of capacity. The report of the Independent Oversight Advisory Committee is a sobering reminder of how overstretched the WHO program is, putting at risk the critical work and the well-being of the staff who do it on our behalf. Second, we echo the IOAC in emphasising that action must be taken to equip WHO with the necessary resources and authority to ensure the health emergencies program is fit for purpose. This includes a sustainably funded core budget with adequate resourcing at all levels, as well as the necessary accountabilities and lines of authority between the Director General, regional directors, the WHO Executive Director, regional emergency directors, WHO representatives and incident managers. Continued prioritisation of prevention of and response to sexual exploitation, abuse and harassment is also essential. Australia urges swift action on the IOAC's recommendations to ensure the WHO program can do what the world expects of it. Third, we share the IOAC expectations that the new Standing Committee on Health Emergency Preparedness and Response will play an important role in driving this action. The committee should facilitate and monitor implementation of the IOAC recommendations, working to support the WHO where necessary, authority and resources to coordinate preparedness, response and resilience. Fourth, we acknowledge the Secretariat's request for guidance on how to continue to support Member States in strengthening IHR implementation, including through national action plans for health security, use of data-driven tools to build sustainable preparedness, and expanding capacities in the priority areas identified in the One Health Joint Action Plan. Although we cannot give detailed guidance in this discussion, we do want to stress the urgency of redoubling efforts to support IHR core capabilities and capacities, drawing on lessons learned from the COVID-19 pandemic and existing monitoring and evaluation tools like JEE. The process of considering proposed amendments through the working group on IHR should not slow or detract from these efforts, and the amendment process must focus on changes we can make collectively to strengthen implementation and compliance. We encourage Member States to leverage available financing mechanisms, including the Pandemic Fund, to accelerate IHR implementation. We also highlight the value of cooperation exercises to test and strengthen coordination and cooperation between the national focal points, such as the Western Pacific region's IHR exercise Crystal. Fifth, we welcome the Director General's proposal to strengthen the global architecture for health emergency preparedness, response and resilience, noting we are still considering the updated paper released only a couple of days ago. Australia appreciates the Secretariat's efforts to move with urgency to advance reform initiatives and support Member State needs, drawing on lessons learned from the pandemic. We encourage you to continue this work in line with existing mandates, but also to focus on coordinated support to ongoing Member State processes addressing many aspects of the 10 proposals. Your proactive provision of information and advice to the INB and the WGIHR is essential to ensure our decision-making is informed by the latest developments and best available evidence. We stress the importance of accelerating momentum to deliver on the INB and WGIHR mandates, and of course, fully aligned with the statement delivered by Indonesia on behalf of MICTA in this regard. Sixth, we want to commend Oman and Switzerland for the leadership on the development of the Global Health for Peace Initiative roadmap to address the health needs of populations in post-conflict recovery, especially for those who are most vulnerable. We also reiterate our support for the work to strengthen clinical trials. And finally, Chair, we reiterate Australia's condemnation in the strongest possible terms of Russia's illegal and immoral invasion of Ukraine. Russia's attacks on healthcare infrastructure deprive people of urgently needed care, endanger healthcare providers and undermine health systems. We appreciate WHO's continued efforts to support the humanitarian emergency response and strongly urge all Member States to support Ukraine's decisions on health emergency in Ukraine and refugee receiving and hosting countries stemming from the Russian Federation's aggression. Thank you, Chair.
Thank you, Delegate of Australia. I now give the floor to Delegate of Belize, followed by Delegate of Norway.
There you go. Thank you, Madam Chair. Belize thanks the Director General for the reports on items 14.1, 14.2, 15.1, and 15.2. The COVID-19 experience holds us responsible to acknowledge the global emerging and re-emerging diseases. These threats do not discriminate nations nor people. We now have been placed at a new starting point whereby we have the opportunity to rebuild a more robust health system. I must acknowledge the support from PAHO as they accompanied us step by step as we traverse this mortal experience. The impact of this pandemic will live with us for the next decades. As of now, we need to retake the path of preparedness along with our key partners and stakeholders. An immediate challenge we need to address is to reinforce the sustainability of our efforts in the areas of laboratory services, information systems, diagnostic imaging, and people-centered healthcare services. The Ministry of Health and Wellness in Belize is committed to join hands with national and UN entities who have a role in the responsibility of creating a level of country preparedness in order to ensure a timely and effective response for future pandemics. The COVID-19 pandemic revealed the gaps in our health system. It is our sacred duty as public health leaders to be on the forefront, using the lessons learned from this recent pandemic to strengthen and support all entities who are on the vanguard of administrative and technical services. Belize also notes the challenges being faced regarding the implementation of the core capacities of the international health regulations and the coordinated approach for the management of acute public health emergencies. While many strides have been made, we still face challenges in laboratory capacity and surveillance, health emergency management, and infection prevention and control. Furthermore, there is also great need for strengthening the areas of policy, legal and regulatory frameworks, norms and standards, human resource capacity, risk communication, and surveillance systems. To address some of these areas, Belize's recent accomplishment is further strengthening and making more functional the One Health approach makes the country better prepared to detect, prevent, control, and respond to health emergencies. The inauguration of the virtual platform in November of 2022 to facilitate information sharing for better decision-making places the country at the cutting edge of innovation and high-level adaptation during an era when information sharing is one of the most important elements during the response to any health event. Through the One Health initiative, the government of Belize is making significant progress in its endeavor of promoting, improving, and defending the health and well-being of all species by enhancing cooperation and collaboration between relevant stakeholders in the human, animal, and environment interface. Furthermore, the intersectoral collaboration will foster leadership and management to achieve these goals. It will also improve the response to future pandemics and outbreaks. As we seek to improve our capacities for pandemic preparedness and response, Belize could benefit from technical cooperation to strengthen its IHR core capacities and the establishment of a national interagency committee to monitor and facilitate the strengthened implementation of the IHR. Going forward, as we aim to be better prepared to detect, prevent, control, and respond to future health emergencies and work towards health system strengthening, we must enhance cooperation and collaboration to have the necessary resources and capacities to achieve greater health gains. Belize remains fully committed in working towards this. I thank you.
Thank you, Belize. Now the floor for Norway, followed by Colombia. Delegate of Norway, please.
Thank you, Chair. On the report from the Independent Oversight Advisory Board, we share many of the concerns, in particular regarding the need for stable and predictable financing to make the program's operations suitable and to ensure long-term contracts for staff. We are pleased that the more sustainable financing of WHO is an issue which will be advanced by this Assembly. Further, we would like to highlight IOAC's recommendation to ensure gender balance in leadership positions, including at the country offices, and need to assure trust in the internal systems by providing accountability, in particular regarding cases of sexual misconduct. On the implementation of the IHRs, Norway attached great importance to the IHRs. The ongoing revision should ensure that they are made an even more effective tool and a strong legal framework for preparedness and response. It is also important to underline countries' common responsibility, both in terms of support to WHO and to each other, established in Article 44. Global health security should be seen as a global public good. We thank the Secretariat for the report listing ongoing initiatives aimed at strengthening the global architecture for health preparedness and response. We underline that WHO's normative and leading roles must be duly taken into account whenever member states discuss improvements to the global health architecture. We also underline that the foundation for safe and scalable care is universal health coverage. We must keep in mind how WHO, The Pandemic Treaty, the Pandemic Fund, and the other global health initiatives can better support and incentivize strengthening health system and achievement of universal health coverage. In the Johannesburg process, South Africa and Norway have, alongside the interested stakeholders, discussed what more equitable access to countermeasures may look like. Any future countermeasure platform should be able to give effect to principles and commitments established through the pandemic agreement. On WHO's work in humanitarian emergencies, we commend WHO and its staff for their tireless efforts across the globe, saving and protecting lives. Protection of civilians, including healthcare workers, is a priority. Women and girls are often the first victims, including of sexual and gender-based violence. We commend WHO's efforts to address these issues, including through WHO's program of surveillance and documentations of attack on health, and it provides accountability. We encourage WHO to continue mainstreaming gender and peace responsiveness and conflict sensitivity in its programming. We expect that these important principles will also be included in the coming Roadmap for Global Health for Peace initiative. Norway has supported the WHE since its inception, and in particular its contingency fund for emergencies to enable WHO to respond to emerging crises on short notice. This year, we will increase our contribution to the CFE. Non-earmarked, flexible and predictable financing is at the heart of effective humanitarian action because in health emergency, every hour counts. Finally, on the implementation of Resolution WHI 75/11, the report underlines the continuing consequences for the health of Ukrainian citizens due to the Russian invasion of Ukraine. We condemn Russia's unjustified and unprovoked aggression against Ukraine in the strongest terms. The continued attacks on civilians and civilian infrastructure, including healthcare facilities, are of grave concern. Ukraine and its population have our full and unwavering support. Norway supports the proposed decision put forward by Ukraine for the Director General to continue reporting on the consequences for health and access to health care services in Ukraine, in line with the implementation of WHI 75/11. The decision point is a logical step, having in mind the continued aggression on Ukraine by Russia. It is therefore highly inappropriate and unfortunate that Russia has proposed a new resolution. Under the guise of neutrality, Russia's draft resolution attempts to absolve the Russian Federation of all responsibility for its invasion of Ukraine and the health emergency it triggered. The draft resolution is, if adopted, undermines the work of the Assembly and the Secretariat. We encourage Member States to vote against Russia's draft resolution. Thank you.
I thank the delegate of Norway, and now I